Good afternoon. My name is Dr. Magadia. I'm the infectious disease specialist here in Anniston. I am also the chief of staff for both Regional Medical Center and Springfield Memorial Hospital. I'm one of the lead physicians for the COVID ward, which I'll be talking briefly about. Today, the COVID ward is no longer in use for the past 7 days. COVID ward is now open for medical, surgical, non-COVID patients. So that's really good news for us. It has been 11 days since our last, actually 13 days since our last COVID patient was admitted. It was March 11th. For the past 2 weeks, we only had two COVID patients that we admitted. One was admitted, like I've said, on the 11th, and nobody has been admitted since then. So this is really good news for the community. Also for the Calhoun County in general, our 7-day average the past week is about 190 cases. Compared that to mid-January of this year, during the Omicron wave, we had about 14,000 cases in a 7-day period that time in mid-January. So this is all good news. Although we're celebrating and this is really good news for everybody, we're still getting somewhat optimistic that this is the end. Although we're hoping that we're not going to reopen the COVID ward, we're still ready. We're preparing. I think this is the time to get our ducks in a row, so to speak, for the next wave, which hopefully does not happen. This is just a brief a community update. I have with me part of the infectious disease team. You guys have met her before. Whitney Watson, our CRNP with infectious disease, and she'll be talking briefly about the other things that we need to do and prepare for the eventuality of next wave. But hopefully that doesn't happen. And with that being said, I wish everybody safe. Hopefully we don't have to say that those famous letters again, the WWWV. But we are still going to be talking about that. Please watch your distance, wear a mask, especially in settings and situations where you don't really know who are you mingling with. Wash your hands, and for those people who have not been vaccinated yet, please get vaccinated. And for those who are eligible for a booster, please get booster. And I will hand the floor now to Whitney.
Hi, my name is Whitney Watson, and I'm a nurse practitioner on the infectious disease team with Dr. Magadia. We've been part of the COVID response here at RMC since the very beginning. I started out as an ICU nurse taking care of COVID-19 patients, and now as part of the infectious disease team, that has been a large part of my role. Today, we are celebrating that it has been several days with our COVID-19 ward closed completely. We did briefly close the COVID-19 ward last summer, but that only lasted for a very short period of time. So today we're setting records. Since the beginning of COVID, this is the longest our COVID-19 ward has been completely closed. I wanted to take a moment now that we're in this lull between COVID surges, and we are cautiously optimistic that another surge is not coming, that another wave of COVID-19 is not coming. I know everyone is so tired of this pandemic and dealing with sickness. I would like to take this moment to encourage everyone, if you're not vaccinated, to go out and get your vaccine. Now is an appropriate time to prepare in case COVID-19 cases surge again. I also want to encourage parents of children to consider COVID-19 vaccination for your children. Personally, I'm a mom. I have 3 sons. They're 15, 13, and 9, and they have all been fully vaccinated. My 2 oldest sons were vaccinated last summer when the FDA approved the Pfizer vaccine for the 12 to 15 or 12 to 18-year-olds. And then my youngest son was vaccinated just before Christmas. None of my children personally experienced any adverse effects from the COVID-19 vaccine. And honestly, they fared better with it than I did. So I think that now would be a really appropriate time to reach out to your child's pediatrician and think about obtaining a COVID-19 vaccine for your children. As we start to loosen mask mandates and we're traveling again and we're going on spring break trips and we're going to amusement parks and having lots of fun and resuming kind of a pre-COVID life, it is still important to make sure that you always kind of watch your distance in crowds. You want to make sure that you try to stay at least 6 feet away from people, or as Dr. Magadia says, watch your distance. If you're uncomfortable, feel free to wear your mask, whether or not there's a mask mandate. I know sometimes in large crowds of people, it can be daunting since we haven't done that for a while. We haven't done large crowds for the last 2 years. Always make sure to wash your hands, and then obviously vaccination is the best weapon that we have against COVID-19. So I want to encourage you to continue to do WWWV, as Dr. Magadia says, and hopefully we are putting COVID in the past. Thank you.